we precondition is because, and I was telling them this.
Shop over $6 million.
All right, calm down, Pandora. So when Dr. Abaji created this 3-step peel, he kept in mind the 3 main components of the skin, which is, I'm like, okay, that's gotta go. Can we stop that?
Yeah, you're turning that off, and
I'm like,
off.
it's okay if it's music now. It was like, I couldn't think.
Too much talking.
So he kept in mind the 3 main components of the tissue, so oils, so lipids, waters, and protein. So the TCA in this will go after the proteins, the SAL will go after the lipids, and the lactic in this will go after the water. So by preconditioning, what we're doing is we're creating a nice even level of lipids, proteins, and water within the tissue. So this is going to penetrate a lot better, and she's going to get a nice even peel. So that's the benefits of preconditioning as well. You can absolutely do this peel without preconditioning, okay? People do, but the patient experience, their tolerance, all of that is diminished. So all I'm doing is pouring it in here. These work well, or glass works well. All right, Izzy, so you're going to hold this band. You're going to put it as close to you as you need. I'm going to start applying, okay? I'm going to continue to apply until you tell me that you need a break, all right? Keep your eyes closed the entire time because we don't want the fumes to cause your eyes to water, okay? So all I do is saturate it and then squeeze it out so it's not drippy.
Okay.
And again, this is how I hold mine. You don't have to hold yours this way.
Okay.
And 1 vial has enough product for the entire
5%.
session?
5% surface area is what that 8 milliliter vial does.
Gotcha.
So when applying, you notice I'm not applying hard pressure. When Dr. Abaji applies this, it's very much like a paint, like a brush stroke. Because TCA penetrates very readily, so we don't need to push it in. You can already see some of the crystallization happening. Oh, wow, that's the first time that's happened. I dropped my thingy. They give you 3. I typically only ever have to use 1, but just dropped one for the first time. So
Is that the main tissue reaction you're looking for, the crystallization?
So this is going to be more of the crystallization of the TCA and the SAL because we can wipe it away.
Right.
If I couldn't wipe it away, then that would be the indication of frosting,
Yes. Okay.
which at that point I wouldn't go over that area again.
Okay.
And I was telling the other ladies this as well. When Dr. Abaji does this peel as well as the controlled depth peel, I mean, he goes over the entire eye and lip tissue. As an esthetician, I'm not doing that. But with this peel, if your patient is preconditioned, you absolutely can do that. So, like, I'll go into the contour, but I'm not going to go into, like, the actual soft globe.
How do you feel? You're okay. All right.
Thumbs up. Is there any benefit to pre-treating with like a glycolic acid cleanser or moisturizer?
So for us, you mean like immediately, like right before I put this on her, or you mean for her to be using at home?
For her to be using at home.
So we have our exfoliating cleanser. The patient can absolutely be on that. And then we also have our glycogent. So it just depends on what you're trying to do. If the patient is thicker skin, oily, suffers from congestion, absolutely putting them on glycogent will help thin out that. Oh, Izzy.
You're just throwing it around on me?
Is he has special powers?
Yes. I'm like, seriously.
So the only thing I ask is when you go under my nose, if you just let me know so I'm not breathing when you do that.
Okay, absolutely.
How many passes, you said?
So this is my 3rd pass, and I am going to let
Chana.
Yeah.
Of those cotton rounds?
nose. Sorry, forgot about your nose.
That's okay.
No, but you can use this one.
Okay.
Just don't drop
keep
it.
saturating it.
Yeah,
Over
and that's usually what I do, so it stays nice and saturated.
let her.
I'm gonna work right around you this way so I can give you some space.
Is there anything you would absolutely have the patient not use beforehand? Tell them to stay off for a couple of weeks beforehand.
No, I mean the only thing is really the actives. You just don't want them to be on it 4 days prior to the peel.
Right.
That's really it.
That's it.
You know, if they have cold sores, of course you're gonna prescribe.
Acyclovir, something like that.
Yep.
Valtrex.
Prophylactic. Yep. And that's really it. You know, you just want them doing their daily skincare the 4 days leading up.
Mhm.
Izzy's going to go home, and she's going to go home with the Revitatrol and another packet of the retinol
The
cream.
fan looks huge in the video. because of
Yeah, it does.
because of the wide angle, it just
Right.
looks really wide. Sorry, you were saying she's gonna go home.
So
with-
she's going to go home with the Revitatrol, which is our epidermal repair cream. Our 1% colloidal oatmeal. It's got Z-Pro in there. It's going to really help strengthen and repair the tissue, and she'll apply that as needed with gentle foaming cleanser. And that's all she's going to do until her skin fully re-epithelializes.
Okay.
So probably about on day 7 or 8, she can then go right back on full protocol.
On her active. Okay.
Yep.
Gotcha.
So, you know, for Izzy, we're doing this peel to help with pigmentation and just the anti-aging properties. If we were doing this peel on somebody who maybe suffered from acne or post-inflammatory hyperpigmentation, they might be on a little bit of a different regimen, which would include the glycogen and things like that to help break up that oil.
Gotcha.
And that would still be a good, so basically what we say for preconditioning is daily skincare, right? And then a high potency retinol to really just help kind of get that skin active and awake again.
Right.
If there is any concern of pigmentation or a possibility of PIH, then they would go on some type of trigrosinase inhibitor. So whether that's our
How do you
Brightex during the day or the hydroquinones.
Right. Gotcha. Can she use the Brightex after?
Oh yeah, when she fully re-epithelializes, she'll
Right.
go right back on full protocol.
Okay, that's what you were saying. With the
Absolutely.
weekend.
Yep.
Now for CO2 laser, typically we kind of stop things sooner and we start
Mhm.
things later.
Right. Well,
because
because
it's
you
more
go
invasive.
further. Yes,
Right, it's more
exactly.
And one of the things we tell our patients is to avoid sun exposure for about 4 weeks or so.
Oh, I mean, yeah.
How about
Of
this?
course.
You gotta be careful
So,
with this.
I mean, what we would ideally say is stay out of the sun, period, and always stay protected, because the whole point is you're getting it for pigmentation.
Right.
You don't want to get back out in the sun.
Right.
So, I mean,
Having said that,
right. Having said that,
in
you
the middle of
do-
the summer, if somebody wants to have a peel and then they're active and
Right.
People-
So
people
they're
are out
going to
running,
want a
biking, whatever.
wide brimmed hat, sunscreen, stay out of direct sunlight for at least 4 weeks.
okay,
That's
same
it.
thing.
We're all good? Yay! Good job, Izzy! Okay, so, and you can see, like, right in here, she's got a little bit of frosting. Right in here, which is very typical, you know, because we move this area more. Also, sinuses, allergies, that time of year. So that's very common. How are you feeling, Izzy?
It's warm.
Okay.
It's not unbearable.
On a
but
scale
it's
of 1 to
definitely
10?
stinging. I don't know, 5, 6.
Perfect.
Does the fan help?
Mm-hmm.
Okay.
If you had a Zimmer, you can absolutely use a Zimmer as well.
Would you like us to hold the fan?
The
I think I'm
Zimmer,
good.
the Zimmer is
It's a cooler.
There
We
you
use
go.
it for CO2 also.
Yeah, so Zimmer is
Oh.
amazing.
Yeah.
So it's like a big, like
Oh, that's worse.
reverse.
It makes it hotter, I think.
Oh, okay.
I don't know.
It's,
Maybe it's heating up
wind.
now.
Too
It's
much
heating
wind.
up now.
And that's
getting
why
warm.
I get this. I bought this fan because they're plastic here. Because a lot of times the patient has that so close, they're either nipping their nose or your fingers
yeah.
or whatever.
Can't hurt
You okay?
yourself with that.
I think this smells good to me a little
Mhm.
bit.
The Zimmer is great if you use it for other things. I would not
Yeah.
advise just
Of course,
buying
yeah.
it just for this.
Yeah.
But it's really amazing. It basically blows, like, think of a vacuum, but opposite. So it blows freezing cold air.
Okay.
Now, I will tell you, the first time I had this peel done and I wasn't preconditioned with CO, I had the Zimmer and I had it so close to my face that my jewelry was freezing and I was getting frost. And that's how uncomfortable I was
Wow.
With the peel.
with the
Because
peel.
you hadn't pre-treated it.
Because
It's getting warm.
Yeah,
Interesting.
so you're going to start peaking.
Getting
so just,
warm.
So just stay there, okay? Just relax. You put that fan as close or as far as way. Turn it up. Do whatever you need to do. What I want you to do is I'm going to wait about 2 minutes, and then we're going to apply the retinol cream packet. Okay?
Does that calm it down?
It
The
neutralizes.
Revitatrol will calm it down.
It neutralizes it, right? What you're about to do next, or
Yeah. So here's
Not really.
here's I'm going to tell you, Izzy, and this is what I tell all my patients. For me, the most uncomfortable part was the application of the retinol cream today, like immediately post, because of what you just said, because we're neutralizing. So the acids on your skin are at about a 1.7 pH, and this 6% retinol cream packet is about a 5.7. So when you jump that far in pH, that acid alkali neutralization that happens, she feels it.
Right.
You're not feeling it because it's more exfoliating or it's tearing off your skin. You're just feeling it because of that neutralization that's happening. The quicker I get the retinol cream on, the quicker
Okay.
I get the Revitatrol.
Then
That's
you need to move
what
fast.
calms you down. Yes. So when I do, and I'm going to apply this just so you can see. So when I do the retinol cream, I like to keep it right in my fingertips because I don't, this is a beautiful 6% retinol cream. I want her to get all the benefit of it. So what I do is I keep it on my fingers,
and you can move quickly with it. Too.
and then I'm going to put the Revitatrol
Oh,
right
cool.
here.
Okay.
Because the sooner,
Okay.
she's going to hate me.
A and then B.
Yeah.
Okay? So this is where when Jeanette was my trainer, I pulled her hands off of my face. But I wasn't preconditioned with
Free.
Zeo. That's my point. You see
Okay,
how
yeah.
comfortable she was? She's like, oh, I'm about a 5 or a 6. If you
Yeah.
weren't preconditioned, the patient literally would be flying up off this table.
Well, I'm
It's
on
very
fire now,
uncomfortable.
Just
Okay.
so you know,
If you
I'm
need
on fire.
if you need to hold a hand, and if you need us to
Yeah.
hold the fan, we can do that.
I
Yeah.
might need you to hold the fan,
Okay.
and I need to just
Here.
get into my
I can
breath
take
here
it.
for a
Yeah,
minute.
I can take it. Get
You
in-
let me know when you're
get
ready.
into your element.
All right, do
Oh
what you
gosh,
need
I'm
to do.
pushing you. Okay. All right, ready. Now, everybody's different. Some people don't feel this the way that I feel this or the way that others do. You doing all right, Izzy?
Mhm.
So I see you give like a quick kind of application to get it off.
Oh, fire!
I know,
Yeah.
I know. You're
Mhm.
going to hate me. It feels, honestly, like there's shards of glass going in your face.
No, it's not that bad.
No?
No,
Oh, well, good
no,
for you.
Not that bad, but definitely hot. Like you're scrubbing on a sunburn, maybe.
Mhm. And I like to get it up into that hairline. No lines of demarcation on the neck.
Yes. Looks good, Izzy. Nice even application. That's really
Yeah, I mean, her skin, and this is the beauty of preconditioning, because her skin absorbed all of it.
Yay, the calming stuff is going on now.
Okay, yay.
Now, when you're applying this, it's really neat because you kind of feel it liquefy.
Oh, that's-
So it's good from the heat.
yeah.
So I don't, you don't want to do a lot of fuss. Just kind of want to
Just get it on. Don't rub it
just
in.
get it on. Yeah, you don't need to like massage or anything like that. You just want to get it on, and then when she sits up and opens up her eyes in a little bit, if there's any areas that she feels she wants to go in and kind of even out, she can.
Yeah.
But ta-da!
Awesome.
Very good.
I made it.
How far down on the neck can you go?
So if we're doing just the face and we're talking
I'm good
about
now.
feathering,
Even
you're
with the
just going
fan,
to
I don't do
feather
that.
down the jawline, right? But if you're actually treating the neck tissue,
Right.
then the patient will have to precondition
All the way down.
all the way down with the exact same number of pumps. So it's not like a dragging, because a lot
Right.
of patients will
Oh,
drag.
Yeah, yeah.
It's the same dosage.
Right.
If you're just going to do the neck and like the V,
Yeah.
that's about a 5% surface area. So that would be one whole peel.
Yeah, I was gonna say it's like the surface area of the face more. or less.
Exactly.
Right, yeah.
But now if they want the whole deck,
right.
that's going to be a whole nother
Another
vial.
5%.
Mhm.
Gotcha. So it's 3 vials.
And would
So-
that help with the wrinkles on my neck, like all the fine lines and wrinkles?
Yes, it does help, but I'm not going to lie, it's not for the faint of heart. So think about if your patient can take 4 to 6 weeks of preconditioning with a Brightenex and a Retamax or a HQ and a Tret on their neck and deck, then yeah, they'll be fine.
Totally fine.
But in no way, shape, or form would I ever, especially on the neck tissue because it is so sensitive, and it would make me nervous with the swelling and the esophagus if they weren't preconditioned.
Right.
And of course, the only contraindications for this would be an allergy to aspirins or salicylates and pregnancy.
Mm-hmm.
That's it.
How long between peels?
Good question. So that's what I was gonna because you asked another question. That's what I was gonna say about the sun. So we do these. You can do these every 3 to 4 weeks.
Okay.
So I would say the same for like sun exposure.
Right.
Right. So 3 to 4 weeks before you go out into the sun because
Right.
it'll take that long for it to re-epithelialize.
Right.
So and that's really where you're going to do them back to back
Mhm.
if you really need to lift that pigment,
Right.
like that
Mhm.
dermal pigment that I showed you in a couple pictures with Dr. Abaji's patient.
Mm-hmm.
You know, she's darker skin. He couldn't do a more aggressive CO2 laser and things like that because she had a resistance to hydroquinone. So he couldn't do anything that deep for her. So he just did back to back three-step peels over the course of 3 months, once a month.
Was it that one?
It was this chick, the one that had the resistance
Okay.
to hydroquinone.
Okay. I'm not burning at all. I feel fine.
You're good?
Good.
Yeah, I'm good.
So you can go ahead and slowly start to open. Good.
I'll move the fan away, otherwise your eyes are gonna get dry.
She had, do
My
you
face
have
is fine, but now my eyes are super dry.
Yeah. Well, I put drops in before we did this, just
Do you
because
have
I didn't want
tissue
my
or
eyes to
something
get
for it?
irritated.
Is there a towel? I just don't want her to.
Oh,